And joining me now is Stillwater's representative to the Oklahoma legislator, Trish Ranson. From Westwood Assemblies to an interview, would have never thought.
I know it's like it's come full circle with the two of us, Brody.
It sure has. Well, let's talk about what's on everyone's mind, COVID-19. What are your thoughts so far?
Well, we are definitely in unprecedented times. The way that the community has reached out and come together in the sense of making sure that we shelter in place, limiting our exposure has been great. Looking forward as to how does it look once we start to lift those restrictions, there's still quite of speculation on that. When is the best time, how it has to be done, and I think we'll keep an eye out for the governor and Mayor Joyce on that, is with what to follow.
You talked about those numbers going down. What would you say to some detractors who say, well, this was a huge overreaction?
I don't think it was. I think that the reason that those numbers are going down is because of the protocol that we followed, and we reacted hard with it, which was good, and especially because of Stillwater Medical Center is a regional medical center, and our cases are mainly coming from rural areas. So the fact that we took such precautions in our urban setting was good to help protect our hospital, to help protect our healthcare workers, to make sure that they weren't overwhelmed. I think that what we've done has been good, and I think we still need to continue to control the spread and to make sure that we're protecting.
What have you been hearing from your constituents at Stillwater Medical? What are their concerns? What are their thoughts?
One concern is PPE, so the personal protection equipment. If you've been watching the news, you've seen that it is a nationwide issue, and states are competing against each other for the PPE. And we had gone through our strategic national stockpile, and we'd gotten our allotment, and now all of that PPE equipment is within our borders. And then we're also seeing, other folks getting a little bit more creative, especially OSU jumping in and making 3D printings of face shields. And they're even looking at what else could they possibly do? What other things could they create that would help Stillwater Medical Center, help the state of Oklahoma, and take a very faceted approach to it. I don't know if you saw on the news lately, Derringers did an order and got through PPE masks so that way they could get it to the hospital. And I think it's going to take a team effort to make sure that we are approaching this whole situation productively.
You're seeing a lot of the Oklahoma Standard on display. Sir, Kevin Stitt has
Yes.
said that on May 4th, I think is the date, maybe 6th, that he plans to reopen the state and go back to his senior citizens immunocompromised staying at home. What are your feelings about that?
I think he's also hedged that, because I think we can't just open the doors and say, okay, everybody go back to the way things were. It has to be a stepwise effort. It has to be in a way that is controlled, because we place correctly. I know that there are things that he's looking at as to what type of restrictions can he loosen a little bit, but I think when it comes down to it, it's going to be us saying, maybe I don't just go to the grocery store all the time again. Maybe I continue to do delivery service. Maybe I continue to go once a week, and really making sure that we are taking care of ourselves so that way we can take care of our community as well.
I don't know how you feel about this, but the curbside pickup at restaurants has been pretty nice, actually. If we stay with that, that's fine by me.
I know I have really enjoyed that, and I've enjoyed, like I said, the delivery. I've gotten my groceries delivered from Sprouts several times during our self-isolation, and it's been a wonderful service.
So, you've got a student in college, one in high school. What has distance learning been like for them, and what have you seen?
Wow. Distance learning students. It's been a challenge for the districts, the teachers, the professors. I know that my son's college courses, a lot of it hasn't changed. and it's just he's doing it from home, and that's been a challenge because he spends quite a bit of his days every day in his room at his computer doing his homework. So it seems like there's a little bit even more work because of the barriers that are placed there because he's not on campus. My daughter in high school, she's a senior, so she has limited things that she needs to get finished in order to graduate, and so she's focusing on those things. But it's frustrating when all four of us in the Ranson household all have to be on the internet at once. And it's been a kind of an interesting juggle to make sure that we can all get done what we need to get done.
Sure, I bet. We felt that pain here at the Meijer House. We got a couple of big
And teacher friends, I check in with them once a week, and it's difficult on that side. I think we have to understand that we're all brand new at this, and we have to give each other grace and give ourselves grace because we're in a learning environment, and sometimes we learn best by failure. So there are going to be failures in this whole endeavor to switch to a distance learning model, and we need to just be able to be okay with that and to know that we're all going to be fine once we get through this.
The two biggest attractions in Stillwater arguably are about a half mile away from each other, Boone Pickens Stadium and the McKnight Center. People are missing those kind of events. Do you see those places reopening to fans, to audiences in August, September?
Oh, it's hard to know. I know that they are both in talks of looking at, okay, well, what would it look like if we didn't open? As you just, I think that's why we have to kind of look out and just look at all the different avenues that we might take through this. And then that way that will prepare us forward. I know that the spring session, there were concerts that were postponed. They've actually added them to the calendar for next year, so that way if you bought tickets, you would be able to go and watch the show that you bought tickets for. When it comes to sports, that's a huge focal point of our community experience. It is a big moneymaker and bringing the money to the college. And I know that the coach is itching to get back on the field and get ready, but we have to really think about, okay, well, what would it look like if we didn't? And that affects the marching band. That affects all of social life of campus. And so we have to look forward if it were a point where we couldn't have our students back, look, how could we continue with learning?
The small business relief, some of the economic impact, those loans that you talked about on your Facebook Live. What can you tell us about that? What do you want your constituents to know?
We've had the PPP loans and the Small Business Administration loans that were coming out, and that PPP loan really was actually that whole idea that you could apply for it as a business owner, a small business owner, and that at the end of the loan, if you still had the same number of employees at the end of the loan as you did when you started the loan, then that money would be forgiven. So it would be treated like a grant. And it was really actually put forward so that way it would encourage small businesses to really use that money for payroll, for rent, and those types of things to keep employees with an employer. They them off employment, keep them tethered to that company. We have now officially, as of I think last Wednesday, ran out of money on that loan program, and so we're looking at the next stimulus bill, the next federal stimulus bill. Hopefully, that will add more money to that program, because there were a lot of small businesses that applied for it that did not get it, that are definitely in need of the aid. So I'm hoping that the next stimulus bill will provide extra funds.
I may be throwing you for a loop here, but I think it's slightly on topic. State Question 802, that's officially going to be on the ballot, that Medicaid expansion, and that certainly relates to what we're dealing with right now. What do you think?
So State Question 802 is the Medicaid expansion. That is on the June ballot, and June 30th. I was very glad to hear that the governor has put that up, coming up close, so that we can vote on that. Now, if it's institutional amendment, which means that it cannot be much unless the federal government says we're not going to give the money for Medicaid expansion anymore. That is a much more protected pool of funds. we're seeing the deficit of that, of not expanding Medicaid right now because of the pandemic and the lack of funds in order to address this issue. Going forward, we need to be in that partnership with the federal government and have that 9-to-1 match going forward. Now, the governor has his own plan. It's a block grant plan. And I worry that if it doesn't pass at the ballot, that it could be possible that he could say, well, we really can't afford this right now, so let's take it off the table. And so that type of expansion is a little bit more at the whims of the political world that we're in. So I would rather do the expansion in that regard. How to fund it? Well, you know, it's the legislative's job to figure out how we're going to fund it. And but I think, how could we not afford to do this for our constituents? We need to make sure that we are caring for the health of Oklahomans.
What's your message to Stillwater right now?
Hang tight, my friends. I know everyone is getting really, really antsy to get out, but you need to make sure that we're still following those protocols by the CDC, wearing a mask when you do go out, limiting the times you go out, washing your hands 20 seconds each time, all of that business. And if you haven't filled out the census, please do, because everybody counts, and we need to make sure that we get as much funding for our city as possible.
Madam Rep, thank you so much for the time. Stay safe out there.
Thank you, Brody. Good to see you.